A Maryland man was born with his heart on the opposite side of his chest. It was never a problem until a common condition forced him to seek treatment, creating a major challenge for doctors who had never seen a case like it. News 4's Erica Gonzalez shares his story of how a local surgeon was able to treat him, giving him peace of mind for years to come.
John Locke has a big heart that beats strong. It's just not where you'd expect to find it. He was born with a rare condition called dextrocardia. His heart is on the right side of his chest instead of the left.
For the doctors, they were listening to my chest and they heard a funny echo.
For most of his life, it didn't affect him at all. No symptoms, no limitations. Locke even competed in triathlons.
Look, I was always an athlete. I always ran hard, cycled hard, did lots of different activities.
But 3 years ago, that changed. He developed atrial fibrillation, often called AFib, an irregular, sometimes rapid heartbeat that can make you feel fatigued, short of breath, or lightheaded. The episodes became more frequent and lasted longer. Locke admits it was scary, especially after the sudden loss of his brother.
My brother had died of a heart attack. I became very concerned about it at that point. Even though my brother had never had AFib or anything like that, he was a perfectly healthy person.
Medication didn't fix the problem, and left untreated, AFib can lead to blood clots, stroke, and even heart failure. So Locke decided to seek treatment with a procedure called a catheter ablation. Doctors thread thin tubes through blood vessels into the heart and use heat or cold energy to create tiny scars. Those scars block the abnormal electrical signals that cause the irregular rhythm. But when doctors in Florida began the procedure, they ran into a problem.
When they got in there, they realized I had other differences. I had an extra vein or something, that basically created a problem for them being able to get to the atriums to be able to do the ablations.
The challenge with dextrocardia is it makes treating atrial fibrillation with catheters difficult, effectively almost impossible.
Dr. Christian Schultz is a cardiac surgeon at MedStar Washington Hospital Center here in D.C. and took on the challenging task of repairing John's heart when no one else could. He performed the 7-hour procedure called hybrid atrial fibrillation convergent therapy that combines two techniques, treating the heart from both the inside and the outside to block the abnormal signals causing the irregular heartbeat. Dr. Schultz says it's not something you study in a textbook because Locke's anatomy is so different than ours, essentially a mirror image of what's normal.
What was most important for me was just the CT, the 3D reconstruction, so I could see his anatomy in order to understand kind of what my approach would be and what needed to be done. Just looking at all the details and kind of generating a map in my head of how I would get there and what needed to be done was critically important.
Dr. Schultz has performed thousands of ablations throughout his career, but Locke was his first patient with dextrocardia. He says the procedure was a success. Now, 61 years old, Locke no longer needs heart medication and says he's back to doing what he loves and grateful for time with his grandkids.
Today I'm sitting here feeling great. I haven't had AFib since the procedure, and I'm living my normal life. My grandkids are the best, and so being able to spend time with them and grow up with them, become a young person again, able to see the world in a different way.
Wow, 7-hour procedure. They do amazing things at MedStar Washington Hospital Center. Doctors say if you notice an irregular heartbeat, don't ignore it. Early treatment can make all the difference.